Okay, so it's Tuesday the 21st of March. The board meeting for March has just now finished. Just a couple of highlights to share with you from this month. First of all, we're going to start with details about the establishment of a mental health collaborative for Suffolk, which took a step closer this afternoon after the board agreed to the setting up of this. And here with us this afternoon is Stuart Richardson, who's Chief Executive of Norfolk and Suffolk Mental Health Trust, and also Richard Watson, Deputy Chief Executive and Director of Transformation and Strategy within the ICB. First of all, starting with you, Richard, tell us about what the collaborative is all about.
Thanks, Simon. I'm really excited that we've just got agreement, Stuart and I, for the setup of the Suffolk Mental Health Collaborative. So in effect, what we're looking to set up is an end-to-end pathway model from all the way from prevention to secondary care, bringing all the partners together across Suffolk that work within that field of mental health to work together on taking joint decisions for the local population around mental health and emotional well-being, which is the first time that we'll actually be doing that, as opposed to working in isolation a lot of the time.
And Stuart, tell us a bit about why the group is so important.
It's really important for us because it allows us to really focus on what's going to make a difference to the people of Suffolk. How can we make sure that the services we provide make a real significant difference to people's lives, but also we start to address the health inequalities that a lot of people experience at the moment, so we can look at people holistically rather than just in isolation by each service.
And this is an exciting development for our system. Who will actually be on this collaborative? What members will be there?
Yeah, so we've tried to be as inclusive as we can be. So it'll involve ourselves and obviously Stuart's team through NSFT, but it'll also involve both of our physical acute and community providers, so ESNEFT and West Suffolk. It'll importantly involve Suffolk County Council, the GP Federation, but also really importantly the voluntary care and social enterprise sector, those with lived experience, which is central to our work, and also Health Watch, and a number of other partners. So really broad and inclusive.
Exciting stuff. Thank you very much indeed, both of you. Whilst staying with Richard, because the joint forward plan was discussed this afternoon during the board. And Richard, tell us a bit about the JFP. What is it all about?
Okay, I'll try and do this in a few words, Simon. So the joint forward plan is effectively our organisation's plan for the next 5 years to deliver effective change for our local population in health and social care. So it sets out a vision, a small set of outcomes, and then a load of different actions that we're going to commit to over the 5 years to deliver for the population. And it importantly involves all the partners that make up the Integrated Care Board. So some of the partners I named in the item we just talked about, the collab, and others. So really important document. And if any of the staff, I know a lot of you have been involved, if any others of you want to get involved, then drop me a personal line and happy to talk to you about it.
And of course the blueprint is very much based on feedback that you've received over the last couple of months. Tell us a bit about some of the feedback you've had.
Yeah, so really importantly, this is really something we've been engaging with our partners and our population. It's not been myself with some of the team in a darkened room. So we went out to a 5-week engagement exercise across Suffolk where we heard from hundreds of different individuals who has helped frame and shape the document as it's now getting into its final form. Some of the key themes that have come up is access. So the fact that a lot of our population are really struggling to access services, particularly after the last 3 years of COVID. Other themes are mental health, so really plays into the fact we're setting up the collaborative, primary care, particularly GP, and also personalisation. So how do we better provide services that are personalised to each individual? So lots of food for thought as we finalise the plan.
And the plan itself will be launched later on this year?
Yeah, so we're in our final stages. We are just working to get to a final draft in April, and then it's making its way through the various committees to sign off, including back here at the ICB Board, and then we're publishing it in June. And thank you to Simon's help and the teams for getting that into a good shape for publishing.
Lovely, thank you very much indeed. Thank you. Some other highlights then from the board this afternoon. Let me just tell you a bit about some of those other key aspects. Scrolling down my screen here. The board was in receipt of the finance report for month 8. Some key highlights from that. The year-to-date and forecast position remain on plan for break-even. The risk against delivery was assessed as being low, and the efficiency forecast was at £15.1 million of the £17.3 million. So this is news there on the finance update. We also heard about the governance updates for delegation of pharmacy, optometry and dental, which is due to come into force next month, better known as POD. West Suffolk's maternity services, and also system performance updates relating to mental health, urgent care, elective care and cancer as well. Now, for a copy of all those papers and for a full recording of the meeting, please do visit the Suffolk and North East Essex ICB website, which is www.suffolkandnortheastessexicb.nhs.uk.